what that is? And if,
well, the
if this is
public
viable?
option,
Yeah.
yes. President Obama during the campaign and even recently earlier this year has said repeatedly that he wanted a so-called public option to be a part of healthcare reform. And what it is would be a government-sponsored insurance option to compete with private insurance out there. The idea that if private insurance was not reaching all of the uninsured Americans, that you would have a government option that would be affordable and would create price competition on premiums. And so the state of the debate right now is that it appears that we're going to get a bill in the U.S. House that will include some sort of public option. But over in the Senate, it looks much less likely that we're going to get a public option. And so what happens when you have two different versions of the bill, this will get worked out in a conference committee. There's been some discussion in Congress recently, too, that if the final conference report does not have a public option, it may end up with what's called a trigger, where if we don't achieve a certain level of insurance within a certain period of time, say in 2 or 3 years or 5 years from now, that would trigger the creation of a so-called public option to compete with private insurance.
And the public option is strictly an option. The private companies are still viable.
Would not be mandated. People would have to, the individual mandate, if we end up with that in the final bill that requires people to buy insurance, they would get to choose between various options.
Okay, another item in the news, something that we heard some time ago now, back in early summer, was death panels. What were the right-wingers talking about when they talked about death panels, and is that a real concern?
Well, you know, a lot of the opponents of healthcare reform have thrown everything but the kitchen sink at this issue, and there's been a lot of misinformation and misrepresentation. In fact, that's been one of the most disturbing parts of the healthcare reform debate this year. But the death panels that you're talking about, this is actually referring to a policy that came up during the administration of President George H.W. Bush, the first President Bush, where they actually changed the Medicare rules to allow healthcare professionals to be reimbursed under Medicare for giving families end-of-life counseling. Prior to that, those healthcare providers couldn't get reimbursed under Medicare, and so the idea was to carry it over into the healthcare reform bill. But the misrepresentation and, you know, the misunderstanding on the part of a lot of people about just what this provision was has now caused them to drop this provision from the bill. But it had nothing to do with denying people care. It had everything to do with saying that healthcare providers could be reimbursed, they'd be eligible for reimbursement from Medicare for talking with your family about end-of-life choices.
So it really helped the healthcare providers, and it really had nothing to do with deciding, you know, if you were going to.
They were not going to create,
live or die.
Right, they were not creating panels to decide whether to pull the plug on grandma or grandpa. That simply is not in there. And what's regrettable is that I think a lot of the opponents of this legislation, they knew that, but they kept saying it anyway.
Amazing distortion. Okay. Another item in the news, employer mandates.
Right.
What
Well,
are
this
they?
is the idea. President Obama, when he's talked about health care, has talked about it as a shared responsibility, that individuals are responsible for taking care of themselves, and in the major bills, there's an individual mandate that would require them to buy acceptable insurance coverage. But the idea is also that about 2/3 of Americans get their insurance through their employer, that the employer either provides all of the care, which is something we're seeing diminishing in recent years, or they at least offer a plan where the employer may pay part of the cost and the employee picks up part of the cost. And so in the bills, in the major bills, there is an employer mandate provision that would require those employers either to provide insurance or to pay into a fund. But there are also exemptions for small employers. If you're a very small employer with 50 or fewer employees, you're basically going to be exempt from the employer mandate provisions.
Okay. Now, with any of these issues that are in the news and with other concerns, again, I would mention the website of the Minnesota Council of Nonprofits, which our crew will be putting on the screen shortly. Okay, now, since we're dealing with Congress and the President, and there are all kinds of political considerations. As one professor I had in college say, you can't take politics out of politics. And Steve Francisco, how many lobbyists are there from insurance companies, the healthcare industry, and other interested parties in Washington dealing with members of the House, the 435 members of the House, and the 100 senators?
Quite a few, as it turns out. I was looking online for some figures knowing you were going to ask me that question, Dan. And the data I saw indicates that just among the insurance industry, there are about 6 lobbyists for every member of Congress. Overall, it's about 10 lobbyists for each member of Congress. So right there, that's over 5,300 lobbyists working full-time on healthcare legislation, either trying to advance some of the provisions, as some of the labor lobbyists have been doing, or trying to make sure that the bill gets changed in ways that will be acceptable to those interest memberships. So you've got healthcare providers, physicians, nurses, hospital administrators, insurance companies. It's a very broad cast of characters who are involved in this debate in Washington.
Thousands and thousands.
It is. And actually, the data I've seen indicate that since the beginning of this year, they have collectively spent approximately $380 million lobbying on healthcare reform as of August this year.
380 million.
380 million.
Wow. Okay. Okay. Another political comment that's made, I see on commercials on TV, on these paid ads, someone will say, "I don't want anyone between me and my doctor."
Well,
could you comment on that?
Sure, it's a noble sentiment, but I guess I would just point out that a lot of people know this. Right now, we have insurance companies that stand between patients and their doctors. And every day, insurance companies are making decisions about which procedures they will or will not cover. And so you have the insurance industry interposing themselves between the healthcare providers and the patients right now. I think what we want to see is a system where if we're going to have private insurance out there, it has to be very strictly regulated so that they can't just raise premiums with no limit on how much those can go up every year, so that they can't cut off people's insurance when they hit some kind of artificial lifetime cap on payouts, and so that they can't deny people for pre-existing conditions.
Okay. These private insurance companies, how are their overhead costs compared to the overhead cost of government-run programs such as Medicare or Social Security?
Well, it's interesting, you know, it turns out that Social Security, Medicare, Medicaid, and even the VA medical system, the administrative costs are considerably less than private insurance. And that's a significant point, because there's often this idea out there that, oh, if we just didn't have Medicare and Medicaid, for example, we wouldn't have a problem with healthcare costs. Of course, nothing could be further from the truth. The reality is that we don't have high healthcare costs just because we have Medicare, Medicaid, or the VA medical system. High healthcare costs are a universal problem, and there are a lot of causes for it.
This leads us right into the Medicare Advantage program. What is the impact upon seniors of this program?
Well, in case our listeners don't know, a few years ago the insurance industry was successful in getting Congress to write into the Medicare law a change which basically allowed private insurance to offer these so-called Medicare Advantage programs, where private insurance would basically be paying the cost rather than Medicare. And the original idea was that they wanted to demonstrate that private insurance was much more efficient than the public programs, the government programs. But a funny thing happened. It turns out that they're not more efficient, and in fact are considerably more costly than Medicare. And so now you have a proposal in the Baucus bill, for example, in the Senate Finance Committee, where he proposes to divert some of that money that was going to private insurance back into the Medicare program to pay benefits. and to extend health care coverage.